for anyone, traveling is stressful, and for anyone, it's exhausting. So anything that you can do that can make that process easier is great. If it's, not procrastinating waiting till the last minute to pack. If it's knowing the type of clothing or type of things that make it easier, more comfortable for you, if you know it's a long flight.
The biggest thing I've learned from managing HAE when traveling is to take my time. I would rather be in an airport for a couple hours, getting the time to find my gate, take a walk, stretch from sitting on a plane, sit down, read a book, then try and rush to make the plane.
I'll also try to see weather before I go. If it's going to be super hot, if it's going to be rainy, if it's going to be excessively cold, since different weather, drastic weathers can be a trigger for me.
Stress is a big trigger for me, so I try to make sure I have everything packed before I go. I take RUCONEST with me on travel. I have a little pack that I just put everything in there, my supplies. It's really easy. If I have to treat attack while I'm traveling, I'm so used to it, I can just do it. It's no problem.
RUCONEST is an injectable prescription medicine that is used to treat acute attacks of hereditary angioedema, also known as HAE, in adult and adolescent patients over the age of 12. Important safety information. Do not use RUCONEST if you have experienced life-threatening, immediate hypersensitivity reactions, including anaphylaxis, to RUCONEST or to any other C1 esterase inhibitor product. Call your healthcare professional or the emergency department right away if you experience wheezing, difficulty breathing, chest tightness, lips and gums turning blue, fast heartbeat, swelling, faintness, rash, or hives. Do not use RUCONEST if you have a known or suspected allergy to rabbits or rabbit-derived products. If you do not have a known rabbit allergy, testing is not required. Tell your healthcare provider about all your medical conditions, including if you have a known allergy to rabbits. Tell your healthcare provider about any other medications you are taking, as some medications, such as birth control pills and certain androgens, can increase risk of clotting problems. Also tell your healthcare provider if you are pregnant, breastfeeding, or planning to do so. The most common side effects patients experience during clinical studies include headache, nausea, and diarrhea. These are not all the possible side effects of RUCONEST. If any of the side effects get serious, or if you notice any side effects not listed here, please inform your healthcare provider or pharmacist. You can also report side effects to the FDA at 1-800-FDA-1088 or visit www.fda.gov/medwatch. For product information, please contact Pharming US toll-free at 844-474-2764. For adverse events, product complaint reports, and medical information, please call 800-930-5221. Please visit www.ruconest.com for full prescribing information, including patient product information.